Are you looking to press rewind on the aging process? Well, forehead Botox may be what you're looking for. Hi everybody, I'm Dr. Stephen Bracci, Verve Medical Cosmetics. Today we're diving into an exciting topic, looking younger in minutes without surgery, without makeup, and without threads. Yes, you've heard it right. We're talking about the Botox Brow Lift. This is a non-surgical forehead lift that can make you look refreshed and younger when done correctly. You can see from her before and after photos the distance from her orbital rim to her eyebrows after the photo. When we scan her face, you can notice how natural everything looks and how she's such a pretty arch to her brows. With this video, you can see how she's fully relaxed in her glabella, that's the area between her brows, as well as the slight movement when she raises her eyebrows, giving her a nice lift to the brows. We used approximately 75 units in total, and we used 25 units for each of the areas, the glabella between the brows, the forehead, and of course the corners of the brows. So why is Botox so popular? Botox has been a household name for years. Did you know that there are other neuromodulators that work similarly? You might have heard of Xeomin, Dysport, Xeomin, and even Daxify. These products all work in a similar way by targeting the neuromuscular level to relax our muscles and reduce wrinkling. So how does this all work? Well, when it comes to brow lifting, this is how Botox works its magic. By injecting Botox into specific areas of the frontalis muscle on the forehead, the main muscle responsible for lifting the eyebrows, we can selectively relax parts of this muscle. This is the key. This reduces the forehead wrinkles without compromising the ability to lift our brows. Additionally, by relaxing the muscles that pull down on the brows, like the corrugator and the procerus muscle between the eyes and the orbicularis muscle at the corners of the eyes, we can allow the frontalis muscle to lift the eyebrows even more effectively. Now let's talk about how our forehead ages. Over time, these repetitive movements, like raising our eyebrows, leads to horizontal lines and droopy eyebrows. These changes affect our overall facial aesthetics by making us look tired or older than we actually are. These repetitive movements bend and wrinkle and damage the skin, leading to permanent collagen damage. So it's called resting lines. So how does Botox come into play as a solution for these aging signs? By strategically injecting Botox into specific muscles, we can reduce wrinkles and lift the brows. This technique involves targeting muscles, again, like the corrugator, the procerus between the brows, and also the orbicularis muscles on the sides of the brows. So let's go through a step-by-step walkthrough of what you can expect during a Botox injection procedure for a forehead lift. First off, you'll have a consultation with your provider to discuss your goals and of course your medical history. Next comes preparation. The area will be cleaned and sometimes a numbing agent is applied to minimize discomfort. Then comes the injection process. A typical dose might include, just for the medial brows, the corrugator and the procerus may require 20 to 30 units. The forehead, which is the frontalis muscle, may require 20 to 30 units. And the lateral brows, the orbicularis muscle, may require 5 or 10 units. In total, you may require about 50 units in total for a comprehensive brow lift. One of the biggest advantages of this procedure is that it's non-surgical. That means minimal downtime and lower risk compared to surgical alternatives. The results are subtle yet effective, enhancing your facial features naturally. And adjustable, that's another key. Typically, you can expect results to last anywhere from 2 months to 4 months or possibly even longer. Of course, every procedure comes with potential risks. Some common concerns include droopy eyelids or brows, or the opposite, where you get Spock brows, where too much isolated frontalis movements tense these eyebrows. To minimize the risk, choose a qualified provider and an experienced injector. Understand that some people are naturally more sensitive to Botox than others. Avoid getting too much Botox too low above your brows. That's where the risk is. If you get too low, you can droop the brows. Make sure your provider treats all the muscles involved comprehensively and discusses all the alternatives. Post-procedure care is critical, ensuring optimal results. Many providers advise avoiding rubbing the area or massaging the treatment area. Stay upright for at least 24 hours. That's another common advice. Avoid strenuous activities is what a lot of providers advise. You'll typically see results, say within a few days to a week, but give it up to 2 weeks to fully see the effects. So just to recap, we've discussed how Botox works at both the scientific, the physical levels, and the aesthetic levels. We've covered how aging affects our forehead. We've talked through the steps by step of these procedures. We've highlighted the benefits and addressed the potential risks. If you're considering Botox for your forehead or your brows, schedule a consultation at my practice, Verve Medical Cosmetics, and let's press rewind together on the aging process.